In this study, we will collect personally identifiable information, such as your name, birth date, phone number, and address, as well as medical information, which is called protected health information. To ensure your information is protected, several procedures are in place at this study site and within the ATN. Only information necessary for the study will be collected, and your data will be securely stored with a unique code number. The link between this code number and your name will be kept separately in a secure area at this study site, accessible only to study staff members and, if necessary, representatives from the NIH and regulatory agencies. You will be asked to complete online surveys using an electronic device, such as a computer, smartphone, or tablet. These survey responses will be encrypted when transmitted to the research team, whose data storage system is both protected and secured. If you participate in an interview, the audio recording will be securely stored and only authorized research team members will have access to it. The recording will be destroyed at the end of the study. The recording will also be transcribed with all identifying information removed, in addition to being saved with your unique code number. Only the research team will have access to the transcript. When registering in the ATN data system to complete online surveys, you may choose to provide your name, phone number, and email address. This information will allow you to log in and allows the system to send you automatic reminders to complete the surveys. Access to your contact information will be limited, protected, and secured. Should you wish, we can share your information from this study with others outside of the ATN, such as your healthcare providers, but only with your written permission. This study is also covered by a certificate of confidentiality from the NIH, meaning researchers cannot be forced to disclose your participation to those not connected with this study, including in response to court subpoenas. However, this does not prevent you from sharing information about your own participation. There are specific circumstances in which your information may be shared outside of the ATN, even with the certificate of confidentiality. If the study staff learns of possible child abuse, neglect, or a risk of harm to yourself or others, we are required to notify the proper authorities. Additionally, if you test positive for certain STIs, this result may be reported to the local health department in accordance with state requirements. The results of the study will be presented at scientific meetings and in publications, but your identity will remain confidential. Study results will be presented collectively, not at the participant level. Excerpts from interview transcripts may be used as examples, but any potentially identifiable information will be removed prior to sharing. Any information shared with ATN researchers outside of this study site will only include the code numbers.